how does your talk connect to the idea of the evolving erotic self? You know, my entire body of work is built on the idea of relational self-awareness, this practice of bringing curiosity and honesty to who we are in our most important relationships. And when we turn that lens specifically towards sexual self-awareness, we ask, what does that look like specifically for our erotic selves? How do we move from being sexualized, performing desire for others, to being actually sexual, meaning connected to our own inner experience of desire? Infidelity blows that question wide open in the most painful and profound ways possible. It forces both partners to stop operating on autopilot and ask, who am I really? What do I want? What have I been suppressing or accommodating or grieving quietly in this relationship? So my workshop is about holding that question with couples, not rushing past it, because the erotic self is always evolving. It doesn't arrive ever at some fixed destination. And infidelity, for as devastating as it is, can actually become a doorway into a more honest, more intentional relationship with one's own desire. That is not easy. It takes a long time, but I've sat with couples who have gotten there, and it is truly remarkable to witness. What's the one thing most people get wrong about sexuality during menopause or after infidelity? I'll speak to infidelity here specifically, since that's the heart of my workshop. The thing I see people get most wrong, and that's couples and clinicians alike, is the assumption that once emotional trust is repaired, the body will just follow, that desire will return on its own once the crisis settles. But sexuality after betrayal has its own complicated arc. The hurt partner often experiences real oscillation, genuine moments of attraction mixed with sudden waves of revulsion or grief or intrusive imagery. And rather than understanding that as a normal part of the healing process, couples often interpret it as a failure, as a sign that something is fundamentally broken. Healing after betrayal is not linear, and the body is always processing what the mind is trying to make sense of. Dr. Sue Johnson's research shows that what differentiates couples who can rebuild from those who can't is whether the partner who did harm is able to stay accessible, responsive, and engaged, what she calls ARE, during those waves. The body needs to learn that it's safe again, and that takes time and it takes presence. It does not happen automatically. What are clinicians often missing when working with clients navigating infidelity? What I see missed most often is what I'd call our own unexamined relationships to infidelity. There are very few topics that spike our anxiety and our judgment like this one. If infidelity touched our family of origin, if we've experienced a betrayal in our own relationships, if we carry strong moral frameworks about fidelity, all of that comes into the therapy room with us. And if we haven't been self-reflective, we end up subtly steering couples based on our own anxiety and blind spots rather than their actual needs and values. I also see clinicians staying too long in stabilization mode. The immediate crisis does require us to stop the bleeding metaphorically, and that's real and that's necessary. But if we never move past survival into the deeper questions, what needs did we each bring that weren't being met? What do we want to build going forward? Who are we now? We're doing our clients a real disservice. The couples who are able to build what I call a marriage 2.0, they don't just repair what was broken, they get underneath it. They get curious about what allowed the conditions for infidelity to develop ever in the first place, which is not a question of blame and fault as much as it's a question of inquiry. That requires a therapist who can tolerate complexity, who can hold space for both partners' pain and both partners' accountability without collapsing under the weight of it. That's the work that I want to help clinicians do in this workshop. How is the idea of getting back to normal a myth? I write and talk about this a lot because it's one of the most important reframes that I offer couples. Infidelity is a turning point. It puts couples at a fork in the road. And one of the paths is what I would call a white-knuckled recovery, staying together but not healed, trying to pretend things are back to how they were, stuffing it down. That path, I can tell you, leads nowhere good. And the other path for couples who want to stay together is harder and longer, but genuinely transformative. building something from the wreckage. And what I tell couples is this: the relationship that you had or thought you had is over. You cannot unknow what you know. You cannot unfeel what you felt. There is no going back to normal. And at first, that truth can feel devastating. Couples hear it as hopelessness. But what I've come to believe after many, many years of sitting with couples in this work is that's actually an invitation. It's an invitation to stop aiming for normal, which wasn't even that great to begin with very often, and to start building something that is more honest, more intentional, and deeply yours. The couples I've worked with who've taken that path, what they build in the aftermath can be robust and intimate and something that they experience with genuine pride, not despite what they went through, but because of it. I don't try to talk clients out of the longing to be back to normal, the longing for what was familiar, for what felt safe, for what felt like home before everything fell apart. That is real. It deserves to be honored. So we start there. I sit with both partners in that space of grief. But then over time, I begin to use what I call relational self-awareness questions to help couples look a bit more thoughtfully at what their normal actually was. Because often when we slow down, the before was not all they've made it out to be in their memories. There were things missing. There was distance or disconnection or desire that nobody named. Infidelity does not come out of nowhere. And this is not about assigning blame to the person who was betrayed. Not at all. It's about inviting both partners into a more nuanced accounting of the relationship as it actually was, because both partners carry something vital into this reckoning process. And then I ask a question that tends to shift things. What would you want to be true about your relationship in 5 years that is not true about it today? Not what do you want to recover, but what do you want to create? And that shift from recovery to creation puts agency back in their hands. And for couples who felt utterly powerless in the aftermath of betrayal, that matters, and it matters tremendously. This is one of the questions that I find to be most alive in this post-infidelity work. So many of us have never really been given permission to know our own erotic selves, to move from being sexualized by culture to actually being sexual on our own terms. And what infidelity does in a painful and deeply unwanted way is it forces that reckoning. And for the person who's been betrayed, the crisis can crack open questions they've never let themselves ask about what they want, about what they have been accommodating in silence, about what their desire has been saying that they have not been listening to. And for the partner who's strayed, and I say this with a lot of compassion because this is complicated territory, there was often a part of themselves, of their erotic selves, that felt seen or unexpressed in the relationship. That is not a justification for harm, but it is an invitation to get deeply curious. What was I longing for? What have I been afraid to bring into this relationship? What do I actually need? And when both partners can hold these questions with curiosity rather than defensiveness, something remarkable becomes possible. The infidelity becomes a turning point, not just in the relationship, but in each person's individual journey toward a more embodied sense of who they are erotically. And that's the work that I'm most passionate about. Repair is foundational. Repair is about restoring a sense of safety. It's helping the hurt partner gradually and imperfectly come to believe that they can trust again. It requires accountability from the partner who strayed. It requires transparency and consistent behavior over time. It requires what Dr. Sue Johnson calls in her research being accessible, responsive, and engaged through waves of grief and anger. And without that foundation, nothing else is possible. But here's what's also the case. Couples who do the repair work and stop there often end up in what's a stable but flat place. They're safe, but they're not alive. And sometimes they mistake that flatness for the ceiling of what's possible when actually it's the floor. Erotic reimagination is something different. It's the work of moving from the outside in to the inside out, from performance to genuine desire, from going through the motions to actually showing up as your full erotic self. And in the context of post-infidelity healing, it means asking, who are we now? What do we want that we had never asked for before? What can we create together that we maybe couldn't have even imagined before this crisis? And some couples aren't ready for that, and that's okay. The repair has to come first, and the repair matters. But the couples who do step into this reinvention work alongside the repair, who build something from the ashes, end up somewhere genuinely extraordinary. Not perfect, not without scars, but with a kind of sacredness and appreciation of being glad that they had stayed.